everyone. Thank you so much for joining us for this conversation. Today, we're going to be talking about how to talk to your parents and elders about COVID-19 and vaccines. And part of the reason this conversation came about was because, I work at the Asian American Resource and Cultural Center, and many of our students have started talking about how their parents or family members have a lot of reticence, or they've been hearing lots of conspiracy theories about why they shouldn't be taking COVID-19 vaccine or why it's dangerous. And so as a way to address it, I just wanted to have a conversation. And we have some wonderful doctors who are here with us today who are going to help explain some things from a clinical side. Again, my name is Allison Kung. I use she, they pronouns. I'm from the Asian American Resource and Cultural Center. I'm the Assistant Director for Education and Outreach.
My name is Charlie Peterson. My pronouns are he, him, his. I am the Manager of Community Engagement and Clinical Research Education at Project which is a clinical research site at UIC, the Division of Infectious Diseases.
I'm Augusto Alanto. I'm one of the infectious diseases physicians at UIC. I'm a clinical associate professor at UIC, but I spend most of my time at the Jesse Brown VA, where I am the medical director for infection prevention.
And I'm Jess Herrick. I am also an attending physician at UIC in infectious diseases, and primarily do kind of research activities.
Well, thank you everybody for being here. We appreciate it. Thank you for your introductions. So I think first of all, let's just do a very basic COVID-19 101 based on where we are today. Doctors Herrick and Alanto, if you want to take it away, please.
Do you want to start, Jess?
Sure. So, I mean, I guess I would say where we are today is actually in probably a pretty good place. Specifically in Illinois, our numbers have been going down. Our daily case count got as high as like 14 or 15,000 every single day. And now we're down to about an average of about 1,500 every day. And that's, probably due to many things, but I think most largely due to vaccinations. We saw our cases drop last summer too, so it may also be sort of a seasonal thing. But I think the biggest cause of the drop is vaccinations. And even if we just look at our hospital, which is probably like any other hospital in Illinois, we've seen that our cases have dropped quite a bit. And sort of stabilized in terms of the number of inpatients we have with COVID. So I would say I feel like we're kind of in a much better place now than we have been for probably since the start of the pandemic.
Yeah, definitely over the last several weeks, the Chicago numbers have gone down significantly. Chicago numbers were at in the 200s range at this time. And our positivity rate in Chicago has been hovering close to, 3.2%. And I think hopefully we break around 2% in the next coming several days. Like Jess says, I work mostly at Jesse Brown VA. Our positivity rate has been going down as well over the last couple of weeks, and hopefully things remain going down. The hard part is getting everyone, as many people as we can, vaccinated. So I know we're having problems at the VA getting the hard to reach people vaccinated. We got the easy ones over the last several months. The easy ones had been vaccinated already, but now comes the hard part.
Well, thanks for that. So I know that we've seen lots of things on the news about how to deal with prevention in our personal lives and everything. But I think we'd be remiss if we didn't just take a little moment to talk about that here, like, kinds of personal hygiene and laundry, PPE, interpersonal contact on parties, because it is the summertime. People have COVID fatigue. Like, people are just like, they need that interaction and everything. And we are getting vaccinated. And, people are, I think they're ready to just like, rip off their masks in like a 1960s fashion and run around and have fun. And I think we all deserve that. But, like, how should we approach, summertime and events, like, given where we are right now?
That's kind of tough to answer. Depends on how comfortable you are with everything that's going on. I mean, it's certainly important to find out what Chicago's positivity rate, the daily cases, and and we can easily get those numbers at the Chicago Department of Public Health website. Certainly, I think at this time, if you have been vaccinated, you can probably not wear masks when you're outdoors. I still feel like I still feel a little nervous when I'm indoors. I was vaccinated several months ago, but when I'm indoors, I definitely keep my mask on.
Yeah, I agree with Dr. Alonto. I would also add that you kind of mentioned a couple of things in the beginning, sort of personal hygiene and groceries, and I know in the beginning there was a big concern about, your mail. Should you, put it in like a COVID jail for a couple of days or something before you open it, or things like that. And I think I feel like kind of the key message is that by far the largest, the thing that the one thing that you can do to really impact things is to get vaccinated, but also just avoid large crowds if you're unvaccinated. Try and move things outdoors as opposed to indoors. So this doesn't really so much spread from groceries or from things you touch. It's much more from things you breathe. And by breathing, it really, the virus very quickly sort of settles down. And so it's much more so, being around somebody than touching something or anything like that.
Thanks for that. I just want to kind of follow suit of something that Dr. Alonto said is, I was vaccinated months ago, and, I do have to go to events for work and stuff. And there are several instances where I just don't feel comfortable if there are a lot of people around and I'm inside. I don't necessarily feel comfortable unmasking. And even though, there's the CDC guidelines that have been published saying that, if you're vaccinated and you're in a group of people that have been vaccinated, you can unmask and feel relatively safe. But in my head, I keep thinking, well, what about the variants, and maybe someone traveled and all of a sudden there's a variant that is going to, maybe bypass a little bit. And I'm like, the vaccines are, they offer a great deal of protection. So, maybe I'll feel sick and stuff, but I still, I don't even want that. So I'm like, I'll mask up.
I totally agree and understand. Like I work out at a gym and I still wear my mask there because I think, there have been some sort of conspiracy theories and things you'll see online about masks, but I would say that masks are absolutely safe. I mean, the data are pretty clear on that. They've had to do studies because of these conspiracy theories. So I would say, there's no harm in wearing a mask, right? If you feel more comfortable, absolutely, you should wear a mask.
Yes. And, vaccines are not 100%
right.
effective. And, we still don't know with the variants that are going on. I think a lot of the data that's coming out at this time says that, says that the vaccines that we have are effective against the variants, but you never know. Here in Illinois, there have been cases of breakthrough infections, and so it's not 100%, and so I'd rather be safe than get the infection.
And also, so we've had numerous cases of people, and the breakthrough infections, for the most part, at least as far as I know, the cases I've seen have all been very mild. But I think the key point is to remember is that this passes from person to person, right? So, I mean, I'm not afraid personally. If I get a breakthrough infection, I feel that, at my age and being vaccinated, it'd be very mild, but I don't want to hurt somebody else, right? I mean, I think that's one of the key things about this pandemic is really we are all in it together, and you don't want to hurt somebody else.
Exactly, and I just want to point out for our viewers that a breakthrough case is a case of COVID in a person that's already been vaccinated.
Fully vaccinated, yeah.
Yes. Okay, well, I thank you for your answers there. So what about the drug space? Like, what's happening? We see like there are all these different options for people in the armamentarium. We've got vaccines, we've got antibody cocktails, we have oral treatments. Although I think the oral options are just for treating COVID. So maybe we could talk about what's out there for people.
Yeah, so in the outpatient setting, we've tried monoclonal antibodies, and at the VA we offer these antibody treatments to patients in the outpatient setting, patients who are not sick enough to be in the hospital but are at higher risk for complications of COVID, and so. There are several antibody therapies for that. And then once they're in the hospital, depending on their condition, if they're requiring any oxygen or requires mechanical ventilation, then there are other medications that we can use. A lot of people have heard of remdesivir, the antiviral medication specifically targeting COVID-19. There are other medications that we can use to help with inflammation, like dexamethasone or other steroids and things like that. And then there are other monoclonal antibody therapies that we can use in the hospital. For the most part, if someone is hospitalized with COVID and they're not requiring any oxygen, or their symptoms are mild to moderate, there really isn't anything specific that we give except for symptomatic therapy, like oxygen or IV fluids. But if they're sicker, then we can give them the other options that I've said before.
I know that there have been some concerns with the vaccine in particular. I know we will be talking a little bit more about like conspiracy theories and those sorts of things in another video. But one big concern that I've heard often is that we don't know the long-term effects of taking the vaccine. Can you speak a little bit about I don't know, what we know or what we might expect, a year from now, will we grow a second head or something like that?
You might, but it won't be because of the vaccine. So I guess the one thing I always want to point out is that I think one of the concerns is that people say it feels like this was rushed. And it's not so much that it was rushed as it's sort of an example of what America can do when we put like our money and our ingenuity, when we put that to work, So absolutely every step that would normally be done for a vaccine was done for this vaccine. It's just that because there was so much sort of money thrown at this, they were able to do the steps sort of in parallel instead of like sequentially. And so every step that would normally be done for a vaccine to come to market was done for these vaccines. The other thing I'd like to point out is that I think in the first couple of weeks, and obviously Dr. Alonso and I were probably among the first 1% of the country to get vaccinated. And I can tell you, me personally, I did not hesitate for a second. I was ecstatic when I got my vaccine. I was so happy. But now we're at a point where we've had 200 million Americans have gotten at least one dose of a vaccine for COVID. So I think if you did have those concerns in the beginning, I could see that, I could see some people saying, well, I want to wait. But now I'm like, we've had 200 Americans get the vaccine. If there were going to be problems, for sure, we would have seen it by now.
Yes. And in addition to, having been rigorously tested, it went through the vaccines that we have went through all three phases of the approval and manufacturing process. After the approval, the safety continues to be monitored. We have the vaccine adverse event reporting system. So people who are receiving the vaccine now, if they have any side effects or any significant problems following the vaccine, these are reported. And that's just recently what happened with the Johnson & Johnson vaccine. When they started seeing people with significant blood clots, that's how they are reported. And then, because of that, there was a pause, and they looked at the data some more, and then they felt that it was safe enough to be used again. And I agree with that. It's that these vaccines are really safe. They are probably the most scrutinized vaccines that's ever been developed.
Yeah. And again, 200 million Americans have gotten it. If there were going to be problems, like, for sure we would have seen them by now.
Yeah, and it's not just the clinical trials where they're monitoring safety, right? Because when I got my vaccination, on my nifty little cell phone, I'd get VSafe messages, asking about my symptoms, if I had any worsening or anything. So there's all of that data collection that we're getting too.
And I mean, you asked the question, could there be any long-term effects of the vaccine? I mean, I think it's extremely unlikely, but anything is possible. But I would argue that there probably is pretty good evidence at this point that there might be long-term impacts from COVID. And I think that is, if you were a betting person in Vegas, I think the odds of you having any sort of long-term complication from COVID are much, much higher, like exponentially higher than the odds of you having any long-term complications from the vaccine.
I agree.
And that, like, any complications from the vaccine, that entered into my mental computations when I was, before I was getting my vaccination. I'm like, so I don't know how I'm going to respond necessarily to the vaccination. To COVID itself. So, maybe I'm like one of the people who has an underlying condition where all of a sudden I'm intubated, or I could get the vaccination and, feel much more confident about my own safety within this space. So thank you. So how about, next steps and stuff? Like, we keep seeing reports about variants. We've got the South African variant, we've got the Manaus variant, English, and then, even in South Asia now we've got like a Mumbai variant, and then there's a Delhi variant. And, what's your take on everything that's going on right now? And, the potentiality of that impacting us even?
Everything is just, we can't predict anything, and everything, it's so unpredictable. And, so that's the reason why we shouldn't let our guard down and keep on just pushing for people to get vaccinated, because I think vaccination is one of the key things to kind of end this pandemic and get back to normal. And, these variants, as far as I know, so far, all the vaccines that we're using work against these variants. But again, you never know.
Right.
And that is the reason why I am more cautious about mask wearing, physical distancing, all those types of things that we always tell our patients to watch out for.
I think that's great because, right now with everything that we've got, it feels, safer, but it takes one mutation, right?
Exactly.
And then all of a sudden you've got another one that's like, down that highway going vroom, vroom.
Mm-hmm.
So, yeah. Well, how about, we've got our 2-shot vaccinations, we've got our one and done. What about, the conferred protection that we get from these vaccines? Like, people are now discussing boosters and stuff. So what information can you share with our viewership on boosters?
We probably will need to have boosters is what it kind of seems like right now. And whether that will be, yearly or at 9 months or that we don't know yet. But I think it does seem likely that we're going to require boosters.
Then I've heard things like, SARS-CoV-2 or COVID-19, it's here for the long term. Do we feel like that's still where we're at? And then, these yearlies, are they going to be much more like our 3-strain or 4-strain, like the trivalent, quadrivalent flu shots that we get every year?
I mean, I think that the answer to that is in part, it's kind of up to the American people, how long this is going to last is really going to depend on how well we do at vaccinating and, maintaining good social distance and having good practices. So I don't know.
I don't think anyone knows. I don't
Yeah.
think anyone knows or can predict what's going to happen in the next couple of years.
No.
If you asked me last year or last Christmas if this was ever gonna, if it's gonna keep on going until now, I think I would have probably said no. So hopefully it dies down, but I'm not sure if anyone knows for sure.
Mm-hmm.
Okay, and then I know that Dr. Herrick does research. Are there any exciting new trials or any new efforts that we should know about?
I mean, I think there are, the ones that I'm most interested in is as time goes by, we're going to get more information about what happens to the immune system, like sort of long-term immune effects. And that will really tell us a lot about the frequency with which we'll need to revaccinate. So that's what I'm kind of most looking forward to, is having that question answered.
We're studying people called COVID long haulers at the VA as well. Because there are a lot of people that are suffering from long-term effects of COVID. And we don't really know much about what's going to happen and how these people end up.
Maybe we could talk a little bit about long COVID symptoms. I know that they're like, microthrombi or like little blood clots, that perpetual feeling of fatigue. What else are you seeing in patients that are presenting with long COVID?
So a lot of the patients that we see at the VA complain of like brain fog. They just can't think clearly. They just can't concentrate. And it's worrisome because it's happening in younger adults, not the older population.
And a lot of patients are still have shortness of breath or problems breathing, which actually probably correlates. They've done some studies showing that some of these patients still have abnormal findings on their CAT scans and still have abnormal what we call spirometry, which is essentially a test that measures, how well oxygen sort of goes in and out of your lungs. So, yeah.
It'd be interesting to see, longer term data, like, does this resolve, and
Yeah.
so just out of curiosity, like, what kind of results are we seeing from people who had COVID and then they are getting their vaccinations as well? Is there any difference there compared to people who didn't have COVID and are being vaccinated?
In terms of like the response or the symptoms?
In terms of their response and,
yeah, they probably have a better
system.
response to the vaccine because it's sort of that memory immune effect.
Right. Actually, I did think of something. This goes back to more our initial conversation about, like, interpersonal contact and stuff, and when we were talking about the gym. So let's say that somebody wants to go swimming. Is an indoor pool, would you consider that safer because of the added humidity and stuff? So there's not really as much aerosolization, or like, the particles, like they might just fall faster than they would in outside, like in a drier atmosphere, or what? That might be a tough one.
Yeah, I think a key is probably just trying to make sure that if you want it to be safe, try to be in places, whether it's indoor or outdoor, where there are not a lot of people. So in terms of the pool, if it's a big pool with, like, just several people versus the pool being packed, I would probably pick the less packed pool.
I think if I went to a pool and the lanes were packed, I'd run away screaming.
Yeah.
But, well, thank you. Do you guys, Doctors Herrick and Alanto, are there any other issues regarding COVID, the clinical space, medical space that you, any messaging that you want to get out there before we wrap things up?
I think one of the things that surprised me is kind of the disconnect between the way healthcare workers feel and the way the general population feels. Like, I can tell you, most of us in our division got vaccinated kind of the same day. And it was, I was telling my mom, I was like, it felt like a war had just ended or something. We were all just giddy and elated, and so relieved. And so it's and I think that's because we've seen firsthand what, COVID can really do. I think in the general population, a lot of people haven't necessarily, if you didn't have a close loved one, who died, they hear the numbers, but it doesn't necessarily sink in. And so I think there's such a disconnect between, again, the elation that we all felt when we got vaccinated and the sort of lack of fear for COVID, but, fear for the vaccine that I think people who aren't in healthcare feel.
Yeah, go ahead, Dr. Long.
No, I think if my last words is that please get your vaccine. It's
we
really
all got it, and we were so happy when we got it.
It's safe. It's effective.
And COVID has just killed 600,000 people. I mean, my goodness, like, how much worse could the vaccine be?
Yes. So please get your vaccine.
Yeah.
It's not just another flu.
It's much worse than,
it's much worse.
Not only does it have the long haul symptoms, but it has between 30 and 50 times the case fatality rate of the flu. So,
that's huge.
Yeah.
So what I'm hearing so far is that, everyone should get vaccinated, and we still should be careful, mask, social distance when we can, because there are still variants, but that the vaccine will still help reduce symptoms and will still make things safer for everyone.
Yes, and I think the vaccine is one of the ways where one of the few ways that this pandemic will end, and our lives can return back to normal.
I also, this is just a small thing, but I also want to point out that vaccines do not make money. I think there's this, when I see a lot of the conspiracy theories and things like that online, it's they're trying to make money. Vaccines do not make money. They're a one-time shot or a two-time shot, and then you're done. I mean, if you were trying to make money, you would want a pill people have to take every day for years, so I think a lot of the mistrust around vaccines is this sort of like, you're trying to push it on me because you'll make money somehow. And that's just absolutely not the case.
And I think to that point, Dr. Herrick, like a lot of people don't see the entire process, like all of the research and development, all of the clinical research sites, all of the people that have to get paid for these initiatives. So yeah, this isn't like a money thing.
Yeah. You don't, it's amazing to me, some of the conspiracy theories about the pandemic. And I hear this, well, the doctors are trying to make money, which is hilarious because infectious disease is the only subspecialty that earns less than a general internist, meaning that all of us in infectious disease did 3 extra years of training to make less money. So it's like, these are not the kind of people who are motivated by money. If we were, we would not be in infectious disease.
Well, thank you. You are heroes, and thank you so much for everything you do. Several of us probably wouldn't be here without you and your work. So
thank you.
So Allison, do you have anything else you want to add?
Yeah, I just wanted to say, thank you so much. One, for the work that you all do on a daily basis. Especially in times like these, I feel like we recognize how important you all are to our safety and the community's safety. So I appreciate your work, and thank you so much for making time so that you could talk with all of us, so that we can know what's going on and what things are safe and how we should take care of ourselves. So thank you so much. I really appreciate it.
Thank you.
Thank you. Thank you.
I'd like to thank the Asian American Resource and Cultural Center for bringing this up to Project Wish, and that we could make this video series a reality. We will be putting the videos and resources online for people to watch on demand. So look out for our awareness campaigns, and we'll let you know when everything launches.
And thank you, Charlie. Also, thank you to Project Wish for making this possible.
Thank you.
Thank you.
All right, everybody. Have a great day.
Thanks.
Bye-bye.